My name's Tony Wagner, 43 years old, and I live in Oakland, California, and I have a wife and I have a daughter. Family's very important to me. I have a tight bond with my family.
Tony is a very caring young man, very much family-oriented. We have a very good relationship. We frequently talk to each other.
At 43, you think you're on top of the world. I just had a kid, just got married, just started a new job in the East Bay, just bought a house. Seems like everything's supposed to click, and then life hits you in the gut, or in the heart, so to speak. About a year ago, my heart was racing, and I'm out of breath. I'm very exhausted. I drove to Eden Medical Center. They saw how fast my heart was beating. They knew something was wrong.
Tony was reporting feeling greatly fatigued. The heart rhythm that he was in was really unstable.
Tony was a young man, and he was also an African-American man, and so that raised our suspicion that Tony had a disease called sarcoidosis, which is an inflammatory condition that affects all organs of the body, but specifically can affect the lungs and the heart. This is a life-threatening condition. Recognizing it was cardiac sarcoid was really critical.
The next step was really one of insight as well. The definitive insights that were able to be achieved at Peninsula after the initial stabilization at Eden could then be acted upon. And that brought together electrophysiologists and advanced heart failure therapists.
By the time he got to us and we looked at all the available information, our index of suspicion for sarcoidosis was also very high. We treated Tony with medications to both strengthen his heart, but most importantly, to really suppress his immune system.
I also then received a defibrillator, and I was released on Saturday. If I would have ended up just going to one hospital, I don't know if I would have been as lucky. I think I'm a living testament to the fact of the coordination between those facilities. It was amazing to see that happen.
I think if you couldn't have a multidisciplinary diagnostic approach here, Tony's outcome would have been markedly different. It is really important to recognize that you need to have many heads at the table to make good decisions for people.
Within the cardiovascular service line, there's trust among all the providers to be able to refer patients to get appropriate care in an efficient fashion, and understanding that it is a collaborative environment where we partner to take care of the patients.
And so when you talk about Eden to Peninsula to CPMC, each one contributing a valuable piece of what ends up being a mosaic that brings into relief the care plan, and you see Tony the way he is right now, I can't tell you how great that feels.
On Instagram, I've been thanking people who have been important in my life. Today, it's fitting that I am thanking the 4 doctors that literally saved my life.
But to think, a year ago, I almost lost my son. Thank goodness Sutter showed up, and they showed up big time.
After getting out of the hospital, I started to really take inventory about the people that were around me and people I really care about. So I make sure to make a concerted effort that when I do spend time with those people, that it's quality time, and I don't take that for granted anymore.